Nutritional needs, fluid needs, and IV therapy. Chapters 30, 31, and 32 in the textbook. Here is an overview of the digestive system. Digestion is the process by which the body breaks down food to be used by cells. Digestion begins in the mouth or oral cavity. The teeth cut, chop, and grind food into small pieces for swallowing. Taste buds on the tongue sense sweet, sour, bitter, and salty tastes. Salivary glands in the mouth secrete saliva, which moistens food to aid in swallowing. Saliva begins the process of digestion. During swallowing, the tongue pushes food into the pharynx or throat. The pharynx is a muscular tube. Contraction of the pharynx pushes food into the esophagus. The esophagus is a muscular tube about 10 inches long that extends from the pharynx to the stomach. Involuntary muscle contractions called peristalsis move food down the esophagus through the GI tract. The stomach is a muscular pouch-like sac. Strong stomach muscles stir and churn food to break it up into very small particles. The stomach secretes gastric juices, which mix with food to form a semi-liquid substance called chyme. Through peristalsis, the chyme is pushed from the stomach into the small intestine. The small intestine is about 20 feet long with 3 parts. The first part is the duodenum, which is where more digestive juices are added to the chyme. One is called bile, which is a greenish liquid made in the liver. Bile is stored in the gallbladder. Juices from the pancreas and small intestine are added to the chyme. Digestive juices chemically break down food into nutrients for absorption. Peristalsis moves chyme through the other parts of the small intestine, the jejunum and ileum. Tiny projections called villi line the small intestines. Villi absorb nutrients into the capillaries. Most nutrient absorption occurs in the jejunum and the ileum. Some chyme is not digested. Undigested chyme passes from the small intestine to the large intestine. More fluid is absorbed. The solid waste that remains is eliminated through the anus. Elimination is the removal of food that is not absorbed from the body. An overview of nutrition. Nutrition is the process of ingestion, digestion, absorption, and use of foods and fluid by the body. A nutrient is a substance that is ingested, digested, absorbed, and used by the body. Nutrients are grouped into fats, proteins, carbohydrates, vitamins, minerals, and water. 1 gram of fat is 9 calories. 1 gram of protein is 4 calories. 1 gram of carbohydrate is 4 calories. A calorie is the fuel or energy value of food. A well-balanced diet and correct calorie intake are needed for growth, healing, and body function. A person's diet affects physical and mental well-being and function. The effects of a poor diet include increased risk for disease and infection, chronic illnesses becoming worse, healing problems, and increased risk for accidents and injuries. The food groups are grains, vegetables, fruits, dairy, and protein. Grains are foods made of wheat, rice, oats, cornmeal, barley, or other cereal grains. Bread, pasta, oatmeal, breakfast cereals, tortillas, and grits are examples. Whole grains have the entire grain kernel. Refined grains are processed to remove the grain kernel. They include white flour, white bread, and white rice. Refined grains have less dietary fiber than whole grains. Vegetables can be cooked, raw, fresh, frozen, canned, dried, or juice. Any fruit or 100% fruit juice counts as part of the fruit group. Avoid fruits that are canned in syrup because it adds sugar. Choose fruits canned in 100% fruit juice or water. Dairy includes all milk products, yogurt, and cheese. Protein foods are made from meat, poultry, seafood, eggs, processed soy products, nuts, and seeds. Beans and peas are in this group and are also in the vegetable group. Dietary guidelines are issued for Americans every 5 years by the government. The My Plate symbol encourages healthy eating from all 5 food groups. The USDA also provides physical activity recommendations. You can search dietaryguidelines.gov for the most current guidelines. The USDA recommends that adults do at least one of the following weekly: 2 hours and 40 minutes of moderate physical activity, or 1 hour and 15 minutes of vigorous physical activity. Moderate physical activity examples include walking briskly, bicycling, gardening, dancing, golfing when you walk and carry the clubs, water aerobics, canoeing, and doubles tennis. Vigorous physical activity includes running, walking very fast, biking more than 10 miles per hour, heavy yard work like chopping wood, swimming, aerobics, competitive basketball, and singles tennis. The USDA recommends that older persons follow the physical activity guidelines for adults. They should be as active as possible. Exercises that maintain or improve balance are helpful for persons who are at risk for falls. This is a picture of the My Plate, and it shows how the different food groups should be portioned out. A nutrient is a substance that is ingested, digested, absorbed, and used by the body. The types of nutrients are water, protein, carbohydrates, fats, vitamins, and minerals. Water is the most important nutrient and is needed for life functions. It can be ingested as liquid, but it is also parts of food. It is 50 to 60% of body weight. It transports waste products out of the body. It keeps people cool via perspiration. It keeps mucous membranes moist. It helps joints move smoothly. Protein is needed for tissue growth and repair. Carbohydrates provide energy and fiber for bowel elimination. Sources are fruit, vegetables, bread, cereals, and sugar. Dietary fiber is found in plant foods. Fiber is not digested. It provides the bulky part of chyme for elimination. Sugars are broken down by the body into glucose. Glucose is used for energy. If carbohydrates are not used, they are turned into fat. Fat produces energy. Fats add flavor and help the body use certain vitamins. Unneeded dietary fat is stored in the body as adipose tissue. Some fats are healthy. Healthy fats include salmon, avocados, and olive oil. Unhealthy fats usually come from animal sources or are processed foods made from vegetable oils. Solid fats are solid at room temperature, so butter, margarine, and shortening. Oils are liquid fats. Oils come from plants and fish. Oils are not a food group. Adult women are allowed 5 to 6 teaspoons of oil daily. Adult men are allowed to have 6 to 7 teaspoons daily. Vitamins are needed for certain body functions. The body stores vitamins A, D, E, and K, which are fat-soluble vitamins. Vitamin C and B complex vitamins are not stored. They must be ingested daily because they get dissolved in water. Minerals are needed for bone and tooth formation, nerve and muscle function, and fluid balance. Calcium is needed for bones and teeth. Iron is needed to transport oxygen throughout the body. Cholesterol is a soft, waxy substance found in the bloodstream in all body cells. The body needs cholesterol to build healthy cells, but at high levels, cholesterol can increase the risk for heart disease. Cholesterol levels are affected by fats. High cholesterol leads to fatty deposits in the blood vessels. High-density lipoprotein, or HDL cholesterol, is known as the good cholesterol because it helps remove other forms of cholesterol from the bloodstream. The liver flushes the cholesterol from the body. Low-density lipoprotein, or LDL cholesterol, is sometimes called bad cholesterol. It makes up most of the body's cholesterol. High levels of LDL increase the risk for heart disease and stroke. Food labels are used to make informed food choices for a healthy diet. They contain the following information: serving size and number of servings in each package, calories, and nutrients. The percent daily value shows how much of a nutrient is in one serving. The percent daily value is based on a 2,000 calorie daily diet. And this is a picture of a food label. There are many factors that affect eating and nutrition. Culture influences dietary practices, food choices, and food preparation. Selecting, preparing, and eating food often involves religion. For instance, the Jewish religion does not eat pork and may require a kosher diet. People who follow the Muslim religion will not eat pork and may require a halal diet, which is food prepared under Islamic dietary guidelines. The Hindu religion does not allow beef. Many Buddhists are vegetarian. Mormons may not drink caffeine or alcohol. People with limited income often buy cheaper carbohydrate foods. Their diets often lack protein and certain vitamins and minerals. Appetite relates to the desire for food. Loss of appetite can occur as individuals age. Food likes and dislikes are influenced by food served in the home. Personal choice may involve a vegetarian diet. Vegan diets exclude all meat and animal products. Lacto-vegetarian diets include dairy products. Lacto-ovo-vegetarian diets include dairy products and eggs. People should avoid foods that cause allergic reactions. Food causing nausea, vomiting, etc. are avoided. Appetite often increases during illness and recovery from injuries. However, nutrient needs increase. Medications can cause appetite loss, confusion, nausea, constipation, impaired taste, or changes to GI function. They can also cause inflammation of the mouth, throat, esophagus, and stomach. Chewing problems such as oral pain, dry or sore mouth, gum disease, and dental problems can also affect eating and nutrition. Disability, such as stroke, pain, confusion, and dry mouth, can cause swallowing problem. Disease or injury can affect the hands, wrists, and arms, which prevent the person from eating independently. And finally, many GI changes occur with aging. Taste and smell dull, appetite decreases, secretion of digestive juices decreases, and calorie needs are lower. Special diets are ordered to address nutritional deficiencies, disease, weight gain or loss, and or to remove certain substances from the diet. A regular diet is a general diet or house diet, and that means that there is no dietary limits or restrictions. Clear liquid is foods liquid at room temperature and clear enough to see through. So Jell-O, apple juice, water, coffee or tea without cream. It does not provide enough nutrients to maintain health for a long period of time. A full liquid diet consists of foods and liquids that can be poured at room temperature. This includes foods on the clear liquid diet and also includes strained soups, milk, milkshakes, plain ice cream, plain pudding, and yogurt. A fluid-restricted diet is ordered for residents with heart or kidney disease. It identifies the specific amount of fluids a person can have in a 24-hour period. A soft diet restricts foods that are hard to chew or swallow. It restricts raw fruits and vegetables and restricts high fiber and spicy foods. A mechanical soft diet is semi-solid foods. Foods are chopped or blended to make them easier to chew. It doesn't restrict high fiber or spicy foods. A pureed diet consists of foods that have a smooth, uniform texture and hold their shape on a spoon, so it's pudding-like. High protein diets are needed to heal wounds and pressure injuries. For low sodium, with too much sodium, the body retains water and tissues swell. There is extra fluid in the blood vessels, causing the heart to work harder. A sodium-controlled diet lowers the amount of sodium in the body. Diabetes is a chronic illness where the body cannot produce or use insulin properly. Insulin lets the body use sugar. Without insulin, sugar builds up in the bloodstream. Healthy foods from each food group may be restricted with a diabetic diet. Carbohydrate counting is when the person keeps track of the amount of carbohydrates eaten each day. It's important to serve meals and snacks at the same time each day to maintain the patient's blood glucose level. Gluten is a protein found in wheat products. Residents with celiac disease cannot tolerate gluten and will have a gluten-free diet. Some age-related changes to eating and nutrition. So first we have physical changes. So you have dysphagia, loss of teeth, which causes difficulty chewing, decreased saliva, which causes difficulty swallowing, decreased sensations of taste and smell, which make food less appealing, decreased ability to see, which makes it difficult to feed oneself, which also makes food less appealing. If you have a decreased activity level, you'll have less appetite and the increased risk of constipation. Special diets also affect eating and nutrition. Foods not prepared with spices have less flavor. Pureed diets are not appealing to the eye. Decreased income makes it difficult to buy foods that the resident enjoys. Lack of social interaction may decrease appetite, and depression may decrease appetite. Medical conditions such as Parkinson's or arthritis can make eating and cooking difficult. And finally, some medications can alter the taste of food or leave a bad taste in the mouth. Some medications may decrease appetite or cause nausea and vomiting. Dysphagia means difficulty swallowing. Food thickness and texture are changed to ease swallowing. So a slow swallow means that the person has difficulty getting enough food and fluids for good nutrition. An unsafe swallow means that food enters the airway. Aspiration is breathing fluid, food, vomit, or an object into the lungs. Aspiration precautions include help with meals and snacks, position the person upright per the care plan, follow the care plan for straw use, straws aren't always allowed, check the person's mouth after eating for pocketing, provide mouth care after eating, report choking, coughing, difficulty breathing, and abnormal respiratory sounds immediately. The dysphagia diet often consists of mechanical soft or pureed foods. Liquids can also be thickened as needed. So thin liquids are regular liquids with no thickener. Nectar thick liquids are mildly thick. The liquid coats and drips off a spoon. It can flow through a straw. Honey thick liquid is moderately thick. The liquid flows off a spoon like honey. The person can drink it from a cup. Pudding thick liquids are extremely thick. The liquid stays on a spoon in a soft mound. It can be sipped or served with a spoon. Thicket is a product that works like cornstarch to thicken liquids. This is a picture of the different consistencies of thickened liquid. To measure food intake, compare food left to that served. To estimate, record the approximate number of food eating. To calculate, subtract the amount left from the amount served. To divide the number by the amount served, the number of pieces making up the whole, and then multiply by 100. So let's practice. 8 apple slices were served and 2 remain on the tray. So 8 minus 2 equals 6. The person ate 6 apple slices. 8 were served. 6 divided by 8 is 0.75 slices were eaten. 0.75 times 100 is 75%. 75% of the apple slices were eaten. When preparing the resident for meals, encourage the resident to toilet before going to the dining room. Have resident wash hands before eating. Encourage the resident to wear glasses and hearing aids, and provide a pleasant area for eating. In regards to a pleasant area for eating, it's important to encourage residents to eat in the dining room with other residents to promote social interaction. If the resident is eating in his or her room, remove the bedpan or urinal from view. Position the patient in an upright position. If in the wheelchair, lock the wheels. Before serving meals, wash hands. You want to offer or provide the resident with a clothing protector. Check the diet card on the tray to ensure that the right resident is receiving the correct tray. Assist the resident to prepare foods. Cut, season, open containers. Provide residents with the appropriate assistive devices to eat, so sippy cup, silverware with built-up handles. Decrease distractions by lowering the TV or radio volume. Talk with the resident respectfully. For the visually impaired resident, identify foods on the plate using numbers on a clock. Some agencies have room service meal programs. A full menu, breakfast, lunch, and dinner is in the person's room. When ready to eat, the person calls the dietary department to place an order. This program allows the person to eat when hungry. For facilities that do not have a room service meal program, it's important to serve food in covered containers to keep food at the correct temperature. Uncover the food just as the person eats. Serve meals in the assigned order. And if food is not served within 15 minutes, recheck the temperature to ensure that it's safe to eat. When feeding the person, serve food and fluids in the order the person prefers. Use teaspoons to feed the person. A teaspoon is safer than a fork. The teaspoon should only be about 1/3 full. And persons with dementia may become distracted during the meals. Foodborne illness are caused by pathogens in food and fluids. Pathogens grow rapidly between 40 and 140 degrees Fahrenheit. Signs and symptoms include abdominal pain, backache, shortness of breath, chills, diarrhea, fever, headache, muscle pain, nausea, vomiting. It's important to clean things by washing hands, utensils, and countertops often. You want to separate to avoid cross-contamination. Do not let raw meat, poultry, or their juices touch other foods that will not be cooked. It's important to cook food to a safe internal temperature and refrigerate or freeze food within 2 hours. And this picture just shows the minimum internal temperature for food safety depending on what's being cooked. Some guidelines for the CNA in regards to nutrition are to check the diet card on the resident's tray, season the food following the resident's preferences, allow the resident to fill out their menu. If a resident doesn't like any of the food on his or her tray, try to replace it with desired foods. Of course, check with the nurse first to ensure that they're allowed. Encourage the resident to eat by making mealtime a pleasant experience. Assist with adaptive devices, and accurately record food intake. Some observations to report regarding nutrition are if a resident eats less than 70% of his or her meals, resident complains of mouth pain, if dentures do not fit or teeth are loose, difficulty chewing or swallowing, if a resident needs increased help eating or drinking, weight gain or weight loss, complaints of constipation, and edema. Water is needed to live. Death can result from too much water or too little water. 2,000 to 2,500 milliliters of water are recommended per day, unless otherwise ordered by a physician. Water is ingested through fluids and foods. Water is lost through urine, feces, and vomit. It is also lost through the skin, perspiration, and the lungs, expiration. An adult needs 1,500 milliliters of water daily to live. About 2,000 to 2,500 mLs are needed for normal fluid balance. To stay hydrated, fluid intake must roughly equal output. So hydration refers to having an adequate amount of water in body tissues. Intake is the amount of fluid taken in. Output is the amount of fluid lost. Edema is the swelling of body tissues with water. Edema occurs when fluid intake exceeds fluid output. It is common in people with heart and kidney diseases. It often occurs in the legs, ankles, and feet. Liver disorders can cause swelling in the abdomen. Pulmonary edema is a severe form of edema affecting the lungs. Edema is a sign of fluid overload. Other signs are weight gain, moist cough, shortness of breath on exertion, and the skin on the legs and feet becoming shiny. Dehydration is a decrease in the amount of water in body tissues. Common causes of dehydration include bleeding, dementia, diarrhea, fever, poor intake, diaphoresis, and vomiting. Signs and symptoms of dehydration include hypotension, confusion, dark urine, dizziness, fatigue, headache, muscle cramps, oliguria, tachycardia, tachypnea, and salivating. Dehydration may cause constipation, UTI, or change in level of consciousness. This picture here just shows a leg with edema. You can see the thumb pushing down and it leaves an indentation in the skin, showing that there's increased fluid buildup. Electrolytes are minerals dissolved in water. Examples include sodium, potassium, calcium, and magnesium. Electrolytes are needed for fluid balance, movement of nutrients into the cells and waste out of the cells, nerve, muscle, heart, and brain function. An electrolyte imbalance occurs when an electrolyte level is either too low or too high. A patient may need a special fluid order to meet fluid needs. The order is part of the person's care plan. Encouraged fluids means the person drinks an increased amount of fluids. It's used to treat or manage dehydration, UTIs, and kidney stones. Restrict fluids means that fluids are limited to a certain amount. It's used to manage edema, kidney failure, and heart failure. NPO means the person cannot eat or drink anything. It's used before surgery and some diagnostic tests. With thickened liquids, water and all fluids are thickened by the dietary department. It's used for patients who have difficulty swallowing. For intake, all oral fluids are measured and recorded, including foods that melt at room temperature. Output is urine, vomit, diarrhea, and wound drainage amounts, which are measured and recorded. This is a picture that shows an intake and output, or INO chart. So let's practice intake and output. A coffee cup holds 8 ounces. The CNA measures 90 milliliters left in the cup following breakfast. How much did the patient drink at breakfast? Well, first you have to know that there are 30 milliliters in each ounce. 8 ounces times 30 mLs gives us 240 milliliters. So 240 milliliters would be a full serving of coffee, minus 90 milliliters, which is what was left in the cup, equals 150 milliliters intake, and that's what would be recorded. Enteral nutrition is giving nutrients into the GI tract through a feeding tube. Gavage is the process of giving a tube feeding. The doctor orders the type of formula, the amount to give, and when to give tube feedings. Tasks involving nutritional support and IV therapy are nursing responsibilities. Some states allow nursing assistants to give tube feedings and feedings via NG tubes. It's important to know your Nurse Practice Act and job description. Tube feedings replace or supplement normal nutrition. Persons with feeding tubes are usually not allowed to eat or drink. They are NPO. Dry mouth, dry lips, and sore throat can cause discomfort. Oral hygiene, lubrication for the lips, and mouth rinses are important. Feeding tubes can irritate and cause pressure on the nose. They can change the shape of the nostril or cause pressure injuries. So this picture here is an NG tube. It goes from the nose into the stomach. This picture here is a nasal enteral tube. It's a feeding tube inserted through the nose into the small intestines. A doctor or a nurse can insert this tube. This is a gastrostomy tube, and it's a feeding tube inserted through a surgically created opening in the stomach. A doctor will insert this tube. This is a PEG tube, a percutaneous endoscopic gastrostomy tube. It's a feeding tube inserted into the stomach through a small incision made in the skin. A scope is used to see inside the body during placement. A G-tube is a small plastic tube with an external bumper to prevent it from dislodging and slipping further into the stomach. A PEG is a type of G-tube. A PEG tube is a type of G-tube that is placed endoscopically. Jejunostomy tube is a feeding tube inserted into a surgical opening in the jejunum of the small intestine. A J tube is a type of G tube that is inserted into the jejunum. Tube feedings can be given 3 ways. So it can be syringe, gravity, or pump. With syringe feedings, the formula is poured into a syringe. The syringe attaches to a feeding tube. The height of the syringe controls how fast the formula will flow. With gravity feedings, the formula is in a feeding bag. Tubing connects the bag to the feeding tube. The bag hangs on a pole. A clamp on the tubing and the height of the bag control how fast the formula flows. With pump feedings, a feeding pump is used. It's called a kangaroo pump. Formula is pumped from the bag through connecting tubing and into a feeding tube. Formula drips into the feeding tube at a certain rate. There are also scheduled and continuous feedings. Scheduled feedings are intermittent feedings are given at certain times. Between 3 to 8 feeds are given each day, usually 240 to 360 mLs with each feeding. Continuous feedings are given over 24 hours via a feeding pump. So this picture on the left, A, shows syringe feedings. The formula is poured into the syringe attaches to the feeding tube, and the height of the syringe controls how fast the formula flows. Picture B shows formula feeding. So you can see the formula feeding bag with tubing that connects the bag to the feeding tube. The bag hangs on an IV pole, and a clamp on the tubing and the height of the bag control how fast the formula flows. And then the bottom right is an example of a kangaroo pump or pump feeding. With a pump feeding, formula is pumped from the bag through connecting tubing and into a feeding tube. Formula drips into a feeding tube at a certain rate. A kangaroo pump is kind of like an IV pump, but for tube feeds. Aspiration is the breathing of food, fluid, vomit, or an object into the lungs. It can cause pneumonia or death. It can occur during NG or nasoenteral tube placement, from the tube moving out of place, or from regurgitation. It's important to report the following at once: nausea, discomfort during the feeding, distended abdomen, coughing, complaints of indigestion, signs of infection at the ostomy site, fever, difficulty breathing, and tachycardia. Coughing, sneezing, vomiting, suctioning, and poor positioning are common causes of a feeding tube moving out of place. A tube can move from the stomach or intestines into the esophagus and then into the airway. The RN checks tube placement before every scheduled tube feed. With continuous feedings, the RN checks tube placement every 4 hours. Regurgitation is the backward flow of stomach contents into the mouth. Delayed stomach emptying and overfeeding are common causes. The following are aspiration precautions. You want to position the patient at 90 degrees before, during, and after feeding. Avoid the left lying position because the left lying position prevents the stomach from emptying into the small intestines. Encourage the patient to take small sips and bites. Alternate liquid and solid swallows. Ensure oral clearance after each bite, and don't allow straws. Straws propel the liquid into the back of the mouth quicker, which can cause swallowing problems in people with dysphagia. Parenteral nutrition is given nutrients through a catheter inserted through the vein. Nutrients are given directly into the bloodstream and do not enter the GI tract. It's often called TPN. The TPN solution contains water, proteins, carbohydrates, vitamins, and minerals. Common reasons for TPN are disease, injury, or surgery to the GI tract, severe trauma, infection, or burns. If patients are NPO for more than 5 to 7 days, they may have TPN. GI side effects from cancer treatments, prolonged coma, and prolonged anorexia are also reasons for TPN. The nurse is responsible for all aspects of the TPN. However, the CNA can report observations to the nurse. Those observations include signs of infection, chest pain, difficulty breathing, cough, nausea, vomiting, tachycardia, pallor, confusion, or behavioral changes. This picture here is a sample TPN order. Labs are drawn each day, and then the TPN is made to match the electrolytes that the patient needs. And this is what TPN looks like. It is the like white substance on the right. IV therapy is given fluids through a catheter inserted into the vein. Fluid flows directly into the bloodstream. IV therapy is ordered to provide fluids when they cannot be taken by mouth, to replace minerals and vitamins lost from illness, to provide sugar for energy, and give medications and blood. Peripheral IV sites are away from the body. Central venous sites are close to the heart. For central line, a catheter is inserted into a vein near the heart. Central lines are used for parenteral nutrition, to give large amounts of fluid, and for long-term IV therapy. RNs are responsible for IV therapy. A peripherally inserted central catheter, or PICC line, begins in a large peripheral vein of the upper arm. The catheter tip ends at the heart. A tunneled catheter begins in a vein in the neck or chest. It passes through the skin and ends at the heart. An implanted port is placed under the skin. A special needle, a Huber needle, is needed to access the device. There's something known as eclampsia, or a central line associated bloodstream infection, and that's when a patient gets an infection and they have a central line. This is a picture of how a PICC line is inserted. This is a picture of a tunneled catheter. These are often used for dialysis until the patient gets their fistula, which is the more permanent access. And this is a picture of an implanted port, which you'll often see for chemotherapy. Implanted ports differ from tunnel catheters in that they are placed entirely under the skin tissue, so there's no exit site, and they're best suited for intermittent treatments.